Bonjour, hello. I want to begin this afternoon, by acknowledging that we are gathered on the traditional unceded territory of the Algonquin Anishinaabe Nation. Pleased to be joined by my colleague, the Honourable Carolyn Bennett, Minister of Mental Health and Addictions and Associate Minister of Health. Last December, Minister Bennett and I were not quite in this room, close to this room, to announce that we would seek the delay of the expansion of medical assistance in dying to people whose sole underlying medical condition is a mental illness. Today, after negotiating with parliamentary colleagues and listening to Canadians, we are doing just that. Plus tôt aujourd'hui, nous avons déposé le projet de loi C-39 qui propose un délai d'un an avant de permettre de l'aide médicale à mourir pour ceux souffrant de troubles mentaux comme seul critère. Ça veut dire mars 2024. Nous avons écouté des experts, des membres de la communauté médicale et des citoyens inquiets qui demandaient plus de temps. On veut d'abord que les systèmes de santé dans toutes les provinces reçoivent des consignes et des normes claires pour administrer l'aide médicale à mourir dans des circonstances difficiles et complexes. Le temps supplémentaire permettra aussi au gouvernement fédéral de considérer le rapport final du comité spécial mixte sur l'aide médicale à mourir attendu le 17 février 2023. I want to provide a bit of background on how we got here today. Medical assistance in dying is a right. The Supreme Court made that clear in its Carter decision in 2015. So in 2016, our government amended the criminal code to make MAID possible for people whose deaths were reasonably foreseeable. The new law had clear safeguards in place to ensure the choice to seek MAID and to ensure that the choice to seek MAID was fully considered and the vulnerable protected. Suivant la décision des tribunaux dans le cas Truchon, nous avons amendé la loi sur l'aide médicale à mourir en 2021 afin de permettre l'aide médicale à mourir pour ceux dont la mort n'est pas raisonnablement paisible. C7 renforçait aussi les mesures de sauvegarde prévues par la loi en créant de nouvelles considérant la complexité apportée. La loi excluait aussi, temporairement, la possibilité de recevoir l'aide médicale à mourir avec un trouble mental comme seule condition médicale jusqu'à mars 2023. C'était pour de bonnes raisons. C7 reconnaissait que l'aide médicale à mourir dans ces circonstances est complexe et requiert une étude approfondie. Ça a permis une révision des protocoles, guides et mesures de sauvegarde par un panel d'experts indépendants sur l'aide médicale à mourir et les troubles mentaux, ainsi que le comité parlementaire mixte. And all of this was happening against the backdrop of the COVID pandemic, which did not help matters. I do want to note in particular the excellent work done in trying circumstances by the expert panel led by Dr. Mona Gupta. And I look forward to receiving the report of the Joint Parliamentary Committee later this month. So it is clear that more time is needed to get this right, which brings us to today's Bill C-39. The proposed one-year expansion is necessary to ensure that we move forward on this sensitive and complex issue in a prudent and measured way. It will provide time to help provincial and territorial partners and the medical and nursing communities to prepare to deliver MAID in these circumstances. It will also allow the completion of in-depth studies of the risks and complexities associated with providing MAID to individuals whose sole underlying condition is mental illness. Nous reconnaissons que certains Canadiens puissent être frustrés et déçus de la prolongation. Je sais qu'il y a des personnes qui vivent des souffrances intolérables à cause des troubles mentaux et qui attendent de se qualifier pour l'aide médicale à mourir. Pour eux, pour leur famille, pour leurs proches, le délai sera difficile. Je veux dire que je comprends, que j'éprouve de l'empathie. Mais je crois aussi que la prolongation est nécessaire pour assurer que l'aide médicale à mourir soit administrée de manière sécuritaire et cohérente dans les cas où les troubles mentaux sont la seule condition médicale. The safety of Canadians must come first. That's why we're taking the additional time necessary to get this right. Protecting the safety and security of vulnerable people and supporting individual autonomy and freedom of choice are central to Canada's MAID regime. We all know that MAID is very complex and it's very personal, so it's not surprising that there is a lot of debate. It should go without saying that seeking MAID is not a decision that one makes lightly. I know from speaking with members of the medical community that take their critical role in this process that they take this role very seriously. I trust that medical professionals have their patients' interests in heart, and this sometimes involves supporting their patients' wishes for a planned, dignified ending that is free of suffering. Le Canada a développé des lois sur l'aide médicale à mourir qui supportent l'autonomie et la liberté de choix, tout en protégeant les plus vulnérables. Nous croyons que le délai proposé dans C-39 va nous permettre de continuer à ce que soit le cas. We call on all parliamentarians to give this bill the swift and urgent consideration it requires. Thank you. Merci.
Monsieur Lametti, est-ce que vous savez combien de cas ça peut concerner quand vous dites qu'il y a des gens qui vont être frustrés par ça? Est-ce qu'il existe un nombre de patients qui sont en attente actuellement?
Je n'ai pas le chiffre exact. On a des meilleurs chiffres, surtout depuis janvier, parce qu'une partie importante du projet de loi C7 était justement une amélioration dans les données provenant surtout des provinces. Ce que je peux vous dire, et peut-être Caroline pourrait en ajouter en tant que médecine et ministre, ce n'est pas un grand nombre. La grande majorité des cas sont des personnes en fin de vie. Donc, la première catégorie. Et c'est encore le cas. Ce n'est pas un grand nombre, mais pour ceux et celles qui souffrent et qui voudraient avoir la possibilité d'avoir l'aide médicale à mourir, c'est très important.
Et qu'est-ce qui se passe après le 17 mars si ce projet de loi-là n'est pas adopté? Est-ce que automatiquement l'aide médicale à mourir est accessible aux gens qui souffrent de troubles mentaux?
On va traverser ce pont. J'espère que non. Je crois sincèrement. Nous avons l'appui de l'NPD et du Bloc québécois. Les conservateurs m'ont poussé très fort quand je suis comparu devant le comité de justice en fin d'année l'an dernier. Et donc, j'espère qu'ils vont continuer d'une manière cohérente après avoir demandé une prolongation. Donc, je suis très confiant qu'on pourrait agir dans les délais nécessaires justement pour éviter cette possibilité.
Mais légalement, ce serait automatique. La loi actuelle C7 s'appliquerait?
Oui.
Puis juste une toute petite dernière, est-ce que c'est une obligation d'en arriver à ça ou est-ce que c'est une volonté? Dans le sens où est-ce qu'il y a des groupes qui disent non, il faut carrément retirer ça de la loi? Est-ce que à l'issue de ces débats-là, on pourrait retirer carrément l'aide médicale à mourir aux gens qui souffrent de troubles mentaux ou ça, c'est pas une possibilité? Ce
n'est pas une possibilité. C'est un droit avant tout, selon la jurisprudence. C'est un choix, ça fait partie de l'autonomie de l'individu et c'est protégé par les cours. Je crois pas sincèrement, en tant que juriste, qu'une telle loi sera pas possible de défendre devant les tribunaux. Donc c'est temporaire et c'est tout.
This is coming up again on another deadline, right? And these deadlines have been set out by your government. So what confidence do you have that a year actually is enough time to deal with what you call a very complicated law and a very complicated situation for medical assistance in death with those who have a sole underlying condition of mental illness?
I'm extremely confident. Much of the work, beginning with the work done by the expert committee, has been done. And at the federal level, there is a very firm belief that everything that we had to do at the federal level is either completed or would be completed by the original deadline. So we're pretty close. A lot of the provinces have done a great deal of work in order to implement it for the original deadline. What we're doing with this deadline is giving time, for whatever reason, COVID or other factors, giving time to those provinces, faculties of medicine, et cetera, to internalize the very, I think, positive guidelines that are given by the expert committee and with the subsequent work done by the federal government, and to allow everybody to be on the same page when we start. But a great deal of the work has already been done. In fact, many people in those communities feel that we were ready to go in March 2023. We need to be prudent. We need to move step by step, making sure that people within the profession, Canadian society at large, has internalized this step. But we're pretty close right now. This is really a safety valve.
Was it rushed in the beginning?
Pardon me?
Was it rushed in the beginning to bring out this, to expand MAID?
No, we've gone step by step with MAID. 2016, 2021. We did obviously the product of this particular part of the bill was in good faith negotiations with the Senate. They brought a significant amount of expertise to that debate and felt it could be done within the timeline that we had. COVID slowed everything down. We have to recognize that possibility. And to be honest, we could have gone forward with the original date, but we want to be sure, we want to be safe, we want everybody to be on the same page. We want, in particular, those health practitioners, those faculties of medicine, colleges who had some concerns to have the time to internalize what is happening.
My colleague Rachel Ayala, on another topic. Do you think it's discriminatory for men who have sex with men that are facing barriers to donate sperm right now? Is that something that you find discriminatory in Canada?
I've made aware of the issue this morning when I read the papers, and certainly we live in a charter society. We're working in other areas as Minister of Justice. I have recently commissioned a study on the blood ban with respect to the gay community. We'll come back to that provision and that report hopefully very quickly. We have now ceased taking submissions with respect to that particular targeted consultation, but this is certainly something that we will look at.
The Quebec government and the Bloc Québécois say that Amira Al-Gawabi's apology comes too little, too late. Do you think that she should resign? Do you think that she can still do the job?
I have said everything really that I want to say with respect to that issue. I raised concerns. She apologized. I said it was for her to apologize. She has. Now, as we say in French, la chance au coureur. The Muslim community leadership in Quebec has called on her to apologize. I am not going to assess the adequacy of those apologies. That's up to her, and I firmly believe, as the Prime Minister has said, and as others in our government, as well as in Canadian and Quebec society, have said that we should give her a chance to do the job now that she has come out with apologies and clarifications.
En français, Monsieur Lametti, là-dessus, êtes-vous satisfait des excuses de Madame Gawabi?
Comme j'ai dit surtout en français tout ce que j'ai à dire là-dessus. C'est à elle de s'expliquer, c'est à elle de s'excuser. Elle l'a fait. Maintenant, on va donner la chance au coureur.
Minister, from the other House leaders that you can pass this legislation before March 17th?
We're very confident. We feel we have the support of both the NDP and the Bloc. And as I said, the Conservatives peppered me with questions when I appeared before committee late in 2022 on this very question, whether we would prolong MAID. I'm going to take them at their word, and I hope that they will support this extension, given that they so vocally supported one at the end of last year.
Minister, the ask for more time to develop things like standard practices and curriculum is not a new one. So at what point did you realize that you were going to need more time to develop these, and when did you start drafting this legislation?
Well, it's an iterative process we've obviously been following. I've been working with my colleagues Bennett and Duclos, and in particular, Minister Duclos has been working with provincial counterparts from the get-go. It really is, as I said, at a certain point, there is at the federal level a great deal of confidence that we would have met the deadline. But in order to be prudent, in order that everybody be on the same page, we heard a number of different voices saying, slow this down. And at that point, it became a question of how long, and those negotiations have led to where we are today.
Maybe you should, just in terms of the practice guidelines from the colleges of physicians and nurses, they're ready. But it is a matter, does everybody understand them, and have they been disseminated in a way that everybody really understands what the safeguards are, what is okay, what's not okay. And then in terms of developing the curricula for the practitioners, both the assessors and the providers, those modules are pretty well ready, and I think everybody felt that they would exist by March 17th. But again, have we been able to disseminate it and get people understanding it? And then, as the minister said, the third thing was about the data, how we are able to track, who's applying, who's accepted, all of that. And we think that new approach to the data is in very good shape now. But I think that it is firstly do no harm. And it is about us having the confidence to make sure that this will be implemented in a safe way.
Minister, the original draft of the legislation with the reasonably foreseeable clause was overturned by the Quebec courts. Did you ever consider appealing that Quebec decision to the Supreme Court to maybe keep that reasonably foreseeable clause, I guess, in the law?
The reasonably foreseeable clause still applies in the end of life scenario. So there's a track, that's the original track from 2016. What the court said in Truchon was that there were other people who, according to the reasoning in Carter, so sections 7 and 15 of the Charter in particular, ought to have access to MAID as well, because they weren't at end of life, but they still were in a situation that was one of intolerable suffering with no hope of getting better. So that's what the Truchon decision added. I said this a number of times at the time in the run-up to Bill C-7, that people were suffering, and we would move quickly. Instead of appealing, we would move quickly. People like Jean Truchon were suffering, and we wanted to alleviate that suffering as quickly as we could.
I'm just curious because both that Truchon decision and the Senate changing the condition about mental illness in their version of the bill took the bill away from the original way you drafted it. Are you concerned that the bill has expanded further than you ever intended because of forces outside of your control, like the courts and the Senate, and now you're introducing a third law to solidify changes that you didn't want in the first place?
In principle, as legislators, we're always in dialogue with the courts. There is a back and forth as part of our Canadian system, where courts interpret what we have done based on the Constitution, whether it be division of powers or whether it be the Charter. That process will continue. I'm a jurist. I welcome that process. I think it has done, frankly, Canadians a great service over the years. Again, both on division of powers and on Charter grounds. The Bill C-7 was a direct response to a legal decision, and we moved on that. That being said, there were a number of voices in 2016 who held that same position that the court held in Truchon in Quebec. The Senate too, we have, I think, provided the most meaningful reform to the Senate in Canadian history. I think it will go down as one of the great legacies of this government. And we have appointed senators who are experts. Dr. Stan Kutcher, for example. Senator Kutcher is an expert in this area. One of the leading clinical practitioners in in mental health, mental illness, and mental disorders. There are a number of other senators who bring a great deal to the table. So of course we're in dialogue with them as a House of Commons. We're part of the legislative process, and bills change over the course of that legislative process, as they have to, in order to take the various institutions in our government seriously, and I respect that.
Minister, recognizing this is federal legislation under the criminal code, how do you respond to provinces like Alberta who say they're not interested in this expansion and they don't think you should go forward with it unless you have the agreement of Alberta?
Well, we work on the criminal code part of this, so what we have done is carved out an exception to what is normally a crime of assisting suicide or even counseling suicide. One falls into an exemption based on the criteria that we have set out for the medical assistance in dying regime. Provinces deliver health care. They have to enforce the criminal code. We've been working with the provinces across Canada with respect to the implementation of this legislation. We worked with them previously as well. So I'm pretty confident that Canadians, wherever they live, want greater access to MAID and will, I think, vindicate those rights where these kinds of rights are not provided by governments, where other Canadians are being provided in other provinces.
Minister Bennett, what is your message to Canadians who are waiting to access MAID and are now potentially going to be waiting another year? What is your message to those people who, it is a very time-sensitive issue?
Well, I think that this issue is very unique. The Track 2 applications are very small, and the ones to do with the only mental illness are a small fraction of that. And so I think that what we also know is a lot had been turned down, and a lot were really being helped by helping them seek the kinds of services, and that we really know that whether it's housing or social services or all of those things, how do we help people navigate to get help? And so I think that again, that all of those things need to be exhausted before anybody would be approved for MAID for just a mental illness. So I think that is in people are learning as we go, but I think that this is new in terms of this what the Senate had suggested, and we believe that we will do everything we can as a compassionate country to help people be comfortable and know they're not alone.
We do have a question online from Palak Mangat. Please go ahead.
Hi, I think this question is for Ms. Bennett as well. Can you specify what the delay in finalizing and sharing modules by CAMAP with practitioners was rooted in? Because it seems like what health officials said this morning was timelines cited last spring weren't set in stone. So my question is, who bears the responsibility here? Is it the Health Canada official inciting ambitious timelines last spring? Is it CAMAP that's who's behind the ball here? Or is it your government for not enforcing the module and dissemination timelines?
Well, I think the expert panel really did a very important piece of work, and I think that I think Dr. Gupta feels the kinds of the practice guidelines for the colleges and regulatory bodies exist. I think that they're obviously working with the practitioners on the modules and the dissemination of those, but I think it really is that as they were developed in the appropriate timelines, aiming for March 17th, that it became clear that maybe it, in terms of the practitioners and those assessors and practitioners, that again, to be able to access the modules and actually learn what's in the modules isn't the same as just having them written down. And so, we actually are very pleased at the way this is being disseminated, the way it feels on the ground in terms of those modules in the curricula, and I think that this extra time will make sure that all of those who are will be assessing these very special cases, as well as the practitioners, to know that they have done it in exactly the way that the experts and the patients deserve.
Could you maybe help me
Okay,
understand?
thank you.
Sorry.
Go ahead.
Oh, sorry. Are we still on?
No, I think she's good.
Okay. Sorry.
Go ahead.
Can you maybe help me understand why the delay is needed in the first place? I'm thinking if this deadline in March would have approached and healthcare practitioners weren't prepared or didn't have the adequate protocols or training in place, they wouldn't have been qualified to offer this service, and it wouldn't have been offered anyways. So in that instance, why do we need the delay anyways? Could we have not have approached that deadline, moved forward, and people whose sole underlying condition is mental illness wouldn't have been able to access Made in the Vacuum because nobody was able to offer it?
I think that it's a matter of having a comprehensive approach that makes sense to people, and I think what we were hearing is that on the ground, people felt that lots were not confident that everybody, was able to have been trained or meet the criteria. So I think that is what has been going on, and I think that certain provinces said we're not ready, and we are, I think, just feeling that and really listening to making sure that all of those pieces are in place, but does everybody know about them? And that requires the help of the professions and the regulatory bodies.
I guess my understanding is that when MAID was originally brought in, we didn't have unity and readiness across the country. Some provinces were, some provinces weren't. What's the difference this time around?
I think that there's no question that the issue of mental health is the single criteria is a very, very special case. Somebody who has a terminal disease is I think was pretty straightforward for a lot of people to be able to die in dignity. I think this is very different, and there's still a lot of people wanting to make sure it's done safely, and that we are being prudent to make sure it will be done safely.
Are you open to other potential amendments as part of this process, or are you only looking at a bill that will push the deadline back a year? If someone came forward with amendments that would otherwise change MAID legislation, are you open to that?
I usually am open, but I'm going to say on this one, I'm going to be less open. Obviously, I never rule out any possibility as a legislator, but this one is about this deadline for the reasons that all of you have touched on in your questions. The vast majority of cases, of MAID cases, are end of life. That's frankly become a part of Canadian society. I've had friends who've opted for MAID recently. It's become part of what people feel they can do. We're talking more now about an exceptional case within a smaller group of cases, as Minister Bennett has just said. We can take the time to get this right. This bill is about taking the time to get that right, and only that.
There are advocates, though, who, I know what you're saying about this being a very small amount of cases, but there are advocates who are concerned that there is no safe way to do this, that there is no appropriate circumstances for someone whose only condition is a mental illness to take their own life with the help of a doctor. Do you think there is a safe way, I guess?
Yeah, I think that I think in principle one has a right, first of all. I think it's part of the sphere of autonomous choices that individuals have, secondly. And I think that Dr. Gupta and her committee has given us a framework that is excellent, and that respects the rights of individuals.
Yeah, and I think that again that the concerns that everybody has had is you have to separate suicidal ideation from wanting to access MAID for a mental condition. We believe the practitioners are very good at sorting out suicidal ideation, but in this particular these unique cases, it's really important that we get this right. In that, I think that a lot of the opposition has been around this is suicide when it is not, and that whatever we can do to explain this is not access to suicide, suicidal ideation is actually part of the criteria that these assessors deal with in terms of being able to access MAID.
Can I just add, just to reinforce what Carolyn has said, this is not about a young person who goes to see their doctor because they're feeling down. That person is rightly seeking help, and they need help. We need to find ways to support them. This is not about suicidal ideation, as Minister Bennett has just said. Those people seek those supports. We as a society have to provide those supports. These are other disorders that have been treated over a sometimes very long period of time, where the person quite understandably says, with the support of his or her doctor, that nothing can work and I can't live like this anymore. It's hard not to feel empathy or compassion for a person in that situation, but it is not the kinds of hypotheticals that are trotted out, oftentimes rather hyperbolically, about, oh, well, someone who has just thought about suicide or is feeling down will get it is not the case. Read the guidelines. It is not the case that we're giving access to MAID in those circumstances.
And can I just ask you a little bit about that? Given those instances where people have been inappropriately offered MAID, do you think that you need to put in perhaps safeguards to prevent this from happening again? My understanding is that MAID can be offered by a nurse practitioner or doctor. In these other instances that we've heard, that wasn't the case. Last time I checked, counseling suicide is still a crime under the criminal code.
It is
Do
indeed.
you need to do more with MAID to ensure that people who aren't in a position to offer MAID aren't offering MAID to people?
First of all, the statistics that we have, and the statistical picture will improve, particularly from January, is that the vast majority of cases MAID is being used properly and in an end-of-life scenario. You've already asked quite rightly that this is a carve-out to the criminal code. So if the criteria are not followed in whatever part of the MAID regime, a doctor, a health practitioner, whoever is the person, is liable to criminal offense. But prior to that, they would also be liable to their medical profession and professional bodies. And so I would say to people, if you know of a case of abuse, if you suspect a case of abuse, go first to your medical body and to the police if necessary to make that known. That's what we do in all cases of the criminal code, and as a system it works reasonably well. But in this case, you've also got the right to complain to a medical body, and I believe me, medical bodies will be quite serious about enforcing these guidelines.
Can you address some of the criticism around expanding MAID to those with mental illness? The criticism seems to come back that, oh, well, there should be actually more focus on making palliative care, broader, more accessible, greater access to mental health resources, therapy, clinical resources, pharmaceuticals, perhaps. Can you address that criticism of the expansion of MAID?
I think that we all agreed that if without adequate palliative care, that this should not be the choice, because people weren't able to live their good life, in dignity. And so, yes, I mean, I think one of the criteria of irreversibility means that you've exhausted all of the possible things that could help this person end up living a better life. So I think that we have to just keep working on adequate palliative care and the hospice system and all of that. But I also think that a lot of the hospice providers are now interested in also providing MAID when that seems appropriate and they're unable to keep that even the penultimate palliative care has this person still suffering.
I would just add to that last question that one of the criteria, very important criteria that we added in 2021 in the non-end-of-life scenario, is that there had to be a meaningful discussion of the options for support in a person's individual case, and that criterion is there, and it's meant to be taken seriously. Obviously, then, as elected public officials, we need to work in our areas of jurisdiction and in the provinces and with the provinces in their areas of jurisdiction to make sure that we support mental health and support for people in those circumstances, that we fight poverty, that we work on homelessness, all of the various factors that I think are amongst the social determinants of what people go through when they're in these when they're in these situations.
We're going to take our last question online. Aaron Anderson, the line is yours.
Hello, can you hear me? Yes. Minister Lametti, you mentioned that the delay would allow for the completion of in-depth studies on the risk. I was just wondering what in-depth studies those were, and shouldn't those be finished before practice standards are developed and finalized?
No, thank you for the question. First of all, the expert committee report has created an excellent roadmap and a number of different guidelines and practice and practice suggestions, directives have been developed because of that. We obviously, as a government, when we legislate, we try to continue to study what we're doing to make sure that the mise en œuvre, as we say in French, the implementation is going as planned, smoothly, according to the goals that we have set, and so that we can course correct if we have to. That's part of that. We're going to continue to do that. But we have enough evidence, we have enough expertise to move forward prudently as we have done. Thank you.
En français, juste savoir, est-ce que la dominante de la décision, elle est liée au code criminel ou elle est liée au système de santé qui n'est pas prêt?
C'est vraiment, comme j'ai dit en anglais, j'aimerais pas dire le système, mais des aspects du système. Donc, on a l'encadrement que le rapport formulé par la Dr Gupta nous a fourni. On a eu déjà des praticums, des guides qui sont presque prêts, mais c'est aussi le cas que des parties du système doivent internaliser l'information, la pratique, les conseils qui sont donnés, les critères qui sont formulés dans l'encadrement. Donc, c'est vraiment une question d'absorber ce qui est déjà là. Donc, système, je vais le mettre entre guillemets, c'est plutôt des aspects, certaines provinces, mais comme la ministre Bennett vient de nous dire, la base est là, la base est presque élaborée. Et donc, c'est vraiment une question que tout le monde soit prêt.